Good evening to all the viewers. Welcome to the IJCP chat show on benefit of probiotics in antibiotic treatment. I am Dr. Shweta Ghadge from the medical team of USV. Antibiotics constitute a major class of drugs commonly prescribed for microbiologically documented infections in clinical practice. The application of probiotics in preventing and managing various disorders has gained considerable interest in recent years. I welcome Dr. Prashant Arun, consultant physician and diabetologist, MV Hospital Diabetes, to share his insights and clinical experience on how probiotics can benefit in antibiotic treatment. Sir, thank you so much for doing this chat show with us today.
Yeah, sure. Thank you. Thank you so much, Dr. Shweta. So today's session for the next, maybe I'll be just giving a short brief of about 1 to 3 minutes. I'll not be boring keeping on talking. After that, maybe we'll move on to the chat, and in the end, we'll take up some questions. So just before we go in, because today's topic is about probiotics, but before that, there are a wide range of antibiotics, like the penicillin group of antibiotics, the cephalosporins, the fluoroquinolones, the aminoglycosides, etc., etc. So there are a wide range of antibiotics. I don't want to step into each and every antibiotic because today's topic is totally about the probiotics. So when we say probiotics, what is it? When we say it is good live bacteria and the yeast. So it's not when we say just bacteria, it does not mean bad. There is the good bacteria and the bad bacteria. So maybe if we say to qualify as the good bacteria, what all do we need? It says it needs to be surviving in the intestine. It needs to have proven benefits and it should be safely consumable. So this probiotics, where is it found? It's mainly these good bacteria, that is, these organisms found in the gut, when you say the intestine, and the other areas are the mouth, vagina, the urinary tract, and skin, lungs, etc. So what do these probiotics do? Yes, we're going to be talking about it a lot, but just a simple thing is it helps in digesting our food. It keeps the bad bacteria in control, and it helps us, break down and absorb the medicines and the food. So these probiotics, what do it contains? As I told you, it contains bacteria and yeast. It's got bacteria like the lactobacillus, the bifidobacterium, and it's got the Saccharomyces, the yeast. And what are these uses of these probiotics? Where all can we use them? So if we think where all we can use these probiotics, we can use it in conditions like diarrhea, constipation, or inflammatory bowel diseases. Most commonly, people have mouth ulcers and urinary tract infection. And in high sepsis cases, when we give high-end antibiotics, also we can use. So these probiotics not only come in tablet form, even natural foods such as yogurt, buttermilk, and cheese have probiotic effects. So with this small insight, I think we can just move on to the discussion, Dr. Shweta.
Yes. So, sir, firstly, very beautifully you've explained the role of probiotics, and even though there are multiple antibiotics available, uh, and they are being used for, common infections. So, sir, can you highlight some of the common infections and what are the antibiotics that are used in a regular clinical practice?
Yeah, so taking into consideration what are the commonly used antibiotics, we'll split this question into two: commonly used infections, commonly used antibiotics. So we cannot miss, maybe taking into consideration the 2020, 2021, 2022, the COVID era. Everybody has lived on azithromycin. Everybody's house, there would have been an azithromycin, there would have been a Dolo 650, there would have been a Montelukast. There is no house without azithromycin. So the famous azithromycin belongs to the macrolides groups. Then we have some broad spectrum antibiotics which we use very frequently. That is the doxycycline. It is a tetracycline group. And then we have the amoxicillin, which is more common, and it is the beta-lactam antibiotics. And few injectables that I use regularly in my practice, because I'm a consultant physician and diabetologist, we see lots of foot infection cases, high-end sepsis and foot infection cases. So we be using imipenem, meropenem, the carbapenem groups of drugs because we use high-end antibiotics. So commonly encountered, if you ask me, infections, we see people having fever with throat pain or urinary tract infection or a lower respiratory tract infection, all that, but it does not mean every fever needs antibiotic. And every lower respiratory tract will really need antibiotics. So these are commonly encountered. So even if it's a urine, as I say, it's very most commonly is urinary infection. So when we take urinary infection also, it is always better to do a urine culture. First do a urine compete, see if there is bacteria, see if there is leukocytes, pus cells, then do a urine culture, then see if there's any organism growing and see what is the organism sensitive to, and then treat. So it's not always blindly treat.
Hmm, hmm, hmm. Yes. So, sir, here very correctly mentioned, and an important point to be noted by all the viewers, that there, even though there are multiple antibiotics available which are commonly used for treating infections, it is extremely important to do cultural sensitivity testing, which is very very important. You just can't blindly give antibiotics for just minor symptoms that patients see. So, sir, why do you believe that antibiotics should not be prescribed so so overly used? And what I want to ask is, what are the common side effects seen with antibiotics?
Yeah, so I would just like to twist the question. It's not the side effects of the antibiotics.
Hmm,
It is the effects that come due to the misuse of antibiotics. Because it's
hmm,
very common in our country. People just misuse. For example, if maybe I am giving a patient who I have treated, who I have seen, I've done a culture, and I'm giving the patient an antibiotic, it is very common that in within the families, when they have complaints, similar complaints, maybe the same person's aunt or friend, somebody have the same complaint, they'll say, I had this problem, doctor gave me this medicine, you also take this medicine. So misuse of antibiotic is most common. So misuse of antibiotic, what happens is misusing antibiotics for smaller problems. Later on, when they have the real problem, the antibiotics will be resistant to it because they don't know. They misusing in the sense using an antibiotic, stopping it in between, not completing the course, all that. This is something like we have a vast set of antibiotics, but if you exhaust all of them, then we'll not have antibiotics for the real problem. So, more than the side effects of the antibiotics, it is more that misuse of antibiotics. Okay, we're taking antibiotics, yes, because the antibiotics can cause a little bit of diarrhea, a little bit of stomach upset or some burning sensation in the stomach or a vomiting sensation. That's because the antibiotic itself alters the body's and intestinal natural flora,
hmm, hmm.
but which is good.
Hmm. So, sir, here, the point that is the highlighting point here is that there is a misuse or an overuse of antibiotics, and especially in when people without consulting doctors, they will go ahead and if anybody comes to them with any problems, so just they will just prescribe. They themselves will just tell, "Ha, ye, take this antibiotic and you will be fine."
Yeah, in
So.
this COVID era, everybody took azithromycin.
Yes, yes, sir. That was a actually it's a very concerning situation. That so much of an overuse. So here, sir, I would also like to understand from you that why is there a need for repeat use of antibiotics in certain conditions?
Repeat use of antibiotics is depends on the condition because either the infection is not controlled or there is a secondary infection that the patient has developed, or it will be that you start on an antibiotic and then the culture reports come and then you see that the antibiotic that the patient initially was started on was not sensitive, it was resistant. So then we'll have to add on the antibiotic according to the culture. That is one of the reasons why we'll be having to change the antibiotic. Two, maybe giving an antibiotic for a while, it has not controlled the infection. We'll have to add on another antibiotic to control the infection. So that is when we add on another antibiotic.
Hmm, hmm. So there are two reasons to
Definitely.
adding antibiotics or prescribing multiple or repeat use of antibiotics. So, sir, now in this because there is repeat use of antibiotics and there is misuse also of antibiotics, how do you perceive antimicrobial resistance in the current scenario?
Yes. So basically, in 2011, the Clinical Journal of Microbiology and Infections actually coined a term. It's called pan drug resistance. Because, as I told you, there are a vast categories of antibiotics and antimicrobial agents. So, this pan drug resistant means the drugs, I mean, the bacteria responds to no antimicrobial agent in any of the antimicrobial category. So, basically, what happens, it becomes very tough. We cannot treat the patient because that bacteria is resistant to everything. So this happens when people overuse antibiotic or they misuse. That is, if you have a cold, I've seen so many people telling me, I have a cold, I took an antibiotic. There's no point. You leave it together, it'll get ready in 7 days. There's no point. And few lower respiratory tracts infections, maybe they do not need any antibiotic. You just need to leave it. So only once you've cultured, you've isolated, or if the patient is getting sick, or 1, 2, 3 days later, we start antibiotics, do a culture, all that is very important. But people just misuse leads to resistance, which what happens is on a later time, they do not have the antibiotics to use because they go into this pan drug resistance. So we've got multi-drug resistant, we've got pan drug resistance, like we've got see, multi-drug resistant is 2, 3 categories. Only drugs will be useful. No other drugs can be used. But when it comes to pan drug resistant, no drugs of antibiotic category can be used for this patient. So this is like what happens is using antibiotics for small issues. So this is like, you have some savings and money that you've saved for some medical emergency, but then you suddenly see something very fascinating. You use up all your savings that you have done to buy that fascinating thing. The next day you develop a medical emergency. You don't have the fund. It's something like that. You have a vast antibiotic category, but you keep using it for small issues and misusing it, not completing the course and all that. Later, when you need it on for the actual problem, there will be no antibiotic which is going to be working for you.
So again, another important point to note here is for the viewers, especially that antibiotics are being misused in today's era, and also that the misuse is leading to a lot of resistance. And when the actual infection is developed, there will come a time when there won't be any antibiotics available because of the multi-drug resistance and pan drug resistance, as sir mentioned here. So, sir, you also mentioned about the side effects of antibiotics. So, how does antibiotic play a role on the gut microbiota? What is the
Yeah.
effect on the gut microbiota?
So basically, what the antibiotic does is it even actually kills the beneficial bacteria. I told you, when there is bacteria, it's not only the good. There is the good bacteria, there is the bad bacteria. So what happens taking this antibiotic? What happens is it actually alters the intestinal flora. It actually kills the beneficial bacteria also. But that really does not mean that you're not supposed to be taking antibiotics, because it is not that the antibiotic is bad. It is doing its job. Collateral damage, it is actually bad. It is actually destroying the good gut microbiota also. But if you do not take the antibiotic, the infection is going to kill you. So just killing the gut microbiota is not going to kill you. So definitely taking an antibiotic is wise. But this gut microbiota, what happens is when you take the antibiotic, even that gets affected. So some people tend to develop some diarrhea and things like that. So at this point of time is where the probiotics takes action. So taking the probiotic with the antibiotic can help it helps neutralize the imbalance, and it can normalize the intestinal flora or the urogenital flora. Can help
So,
bring back the good bacteria.
Yes, sir. So again, a very nice point highlighted by you that it is important to take antibiotics, and that antibiotics does help prevent or decrease the symptoms of the infections. But the collateral damage is the good gut microbiota, which the dysbiotic states leads to diarrhea and other GI disturbances. So
See, Dr. Shweta, I'm
yes,
unable to hear you. There's a
yes, sir.
small.
Am I audible now?
Yeah, you're clear. You're clear.
Yes. So that leads to the dysbiosis leads to a lot of GI disturbances and diarrhea and various other symptoms. So, sir, can you highlight on how probiotics? You mentioned about use of probiotics to replenish the good bacteria, but how does probiotic benefit in like getting the dysbiotic state out of getting the out of the dysbiotic state?
So basically, what happens is these probiotics again restore the intestinal lumen, all of the natural pH, and they actually help build the good bacteria. Because we've got so many strains of bacteria inside the gut, like the Staphylococcus faecalis, the Clostridium, and all that. So what happens is this probiotic actually helps neutralize the lumen pH and actually helps in bringing back the already killed good bacteria, and it brings helps the gut improve. It helps mainly in the gut health. The probiotic works there.
Okay, okay. And so yes, so that probiotics is important, and can be supplemented with antibiotics because the collateral damage is controlled here.
Yes.
Sir, what is the efficacy of multi-strain probiotics in in improving antibiotic therapy?
Yeah, so basically, this is just one strain of good bacteria. Instead, in the tablet form, if you're saying, they use multiple strains. Like again, I said, Streptococcus faecalis, Clostridium. They use the Bacillus. They use the Lactobacillus. They use the Bifidobacteria. So this is called the multi-strain probiotic. Now, when I say multi-strain, it means it's not just one strain. They mix up few strains and they give it. But now, when I say multi-strain, then the next question should not be like, which is the best strain for me? Everything is good. All the strains are good. So then next people should not go starting, you know, next they'll go strain shopping. Which strain is good? I need the best in these strains. Everything is good. Everything is actually good. So it's a combination is called the multi-strain. With a combination of all these together is called the multi-strain probiotic.
So here again, another important point that multi-strain probiotic does help in improving the antibiotic therapy, and that it's not about a single strain but a combination of strains which gives the benefit.
Yeah, but
So
it's
here,
not which combination is better. All the combinations are better.
well, okay. Yes. Sir, here we would also like to, understand that in which specific indications can probiotics be used as an add-on to antibiotic therapy to improve the symptoms?
If you ask me, I would say that giving an antibiotic, okay, yes, it is always better you start with a probiotic also. That is throughout the antibiotic course. But if you ask me where specifically would you add a probiotic with an antibiotic is few people, as soon as you start the antibiotic, they develop diarrhea, stomach irritation, and symptoms. So for those kind of patients, it is more accurate to start the probiotic and continue with the antibiotic. And once you stop the antibiotic, it's better you continue the probiotic for a little more longer time till you restore the gut flora.
Hmm. Hmm. Okay. So, yes, so here it is important to, start as soon as side effects or, any antibiotic use, if there is any side effect seen, then it is important to start probiotic supplementation. So, sir, since you mentioned about, that side effects are seen with antibiotics, can you also highlight on some of the, commonly prescribed antibiotics with which you see GI disturbances and that adding a probiotic will be beneficial?
Yeah, I see a lot of patients who I start on amoxiclav coming with complaints of GI irritation, or if I'm starting on a doxycycline coming with a GI irritation, they come amoxiclav, they immediately come with saying, "Sir, I have severe diarrhea." And actually, starting the patients on antibiotic itself is for a cause. But what happens is because of the like loose stools, diarrhea, or the stomach GI symptoms, many patients tend to stop the antibiotic. So what happens is the cause for what we gave the antibiotic is lost because what happens? One, he stops the antibiotic midway. He develops resistance to the antibiotic. Two, the cause we gave the antibiotic is also not addressed. So what happens? Few patients tend to stop it because of the GI disturbance and the diarrhea. So with these drugs, if we can, if whenever I prescribe an amoxiclav or a doxycycline, I always give a probiotic together.
Okay.
Or if I'm prescribing any higher end antibiotics, also maybe like imipenem, meropenem for my patients, even if I'm giving injectables, also I'll be giving them the probiotics together.
Okay, okay. So, commonly seen antibiotics whenever there is a GI side effect seen, then probiotic adding on a probiotic does give the benefit. It controls the
Definitely,
side
definitely.
effects.
Yes.
So, sir, you mentioned about patients stopping. One of the reasons that antibiotics don't work is because patients stop the therapy midway due to the side effects that are seen. So, does adding a probiotic improve patient adherence and compliance?
Definitely. Because see, patient to stop the antibiotic, he needs a reason. We do not give him a reason to stop the antibiotic. If the antibiotic causes no harm for him and if it's going to give him only benefits, then he will definitely continue. So the reason for the patient stopping the antibiotic will one be either due to gastritis, two he can be stopping it because of his severe loose stools. So in few patients who, what happens is the loose stools itself produces dehydration. So in these conditions, when we start the patient on an antibiotic, when we start them on with the probiotic itself, what happens? We will overcome the diarrhea or the gastric symptoms. Where what is beneficial is going to the patient is, one, he is not going to discontinue the medicine, so he's going to not develop resistance. That's one. Two, he's going to continue the medicine, which is going to actually cure him of the problem. Three, he's not going to have any disturbance. He's just going to take a pill, do his normal routine. So it's always advisable that you start to attain the antibiotics complete efficacy.
Yes. So again, another important point highlighted by Sir here is that when one of the major reasons that antibiotics are not continued by patients is because of the GI side effects, and adding probiotics does help complete that antibiotic course as well, which will also reduce the infection chances. So, sir, here I would also like to understand that can you share a clinical experience, where you've used probiotics with antibiotics and it has helped you in your clinical practice?
Why take clinical practice? Take me. I'll give you me as an example. I am my gastric is very this thing sensitive. So each time I take an antibiotic, initially when I used to not take it with a probiotic, I used to take. I don't want to mention any particular brand or any particular. Because when I say it, it becomes against me itself. So I'm not using any brand or molecule. But what happens is I develop severe GI symptoms and diarrhea. Or take my parents for that instance. I give them antibiotic. They come and tell me, please don't give this antibiotic to anybody else because I am not able to tolerate it. I just want to stop it. When will it get over? So immediately what I do is I start them on a probiotic. And they actually are relieved because the once the loose stools settle, then they don't come and start pestering me. So why take patience? Me, I have my own personal experience. To my parents also. So they just come and just adding on a probiotic actually improves the gut. And not only that, even it's not only with the antibiotic. We don't have to stick only to antibiotic probiotic. Without even antibiotic, for people with generally having diarrhea or other inflammatory bowel disease or any malabsorptions and things, we could add on a probiotic. It to improve the gut health. So it's not only the antibiotic, not only for patients on antibiotic. Even people who have regular diarrhea who do not have antibiotic. It's not that only antibiotic produces diarrhea. Maybe having some chicken outside which was spoiled or something could have diarrhea. And that diarrhea also alters the gut flora. So at that point of time, also you can take the probiotic. Let's not link the probiotic only to antibiotic. Let's not get them married.
Yes, so great, sir. Firstly, it's a very nice thing to hear from you that you have yourself had positive experience and your family has had positive experience with add-on probiotic treatment to antibiotic. And a very good point highlighted by sir that is very important for audience to know that along with antibiotic, probiotics should be given as an add-on therapy to limit the GI disturbances, but also for other GI disturbances such as IBS and malabsorption disorders. There also probiotics do have an effect that they play. So, sir, any final message that you would like to give to the viewers today?
Yeah, my final, actually, I think I gave off my final message before the conclusion. So, probiotics and antibiotics are not married, they are two different species. So, it does not mean that, probiotics need to come into play only when the antibiotic is given. Probiotics can be taken for people who really feel that their gut health is not good. Maybe they are having diarrhea for some reason, or many people I have treated for, I have given them probiotics when they have the mouth ulcers because it helps regain the natural flora. So it can be given for mouth ulcers, it can be given for urinary tract infections, it can be given for diarrheas. So it is not only people on antibiotic that need to take probiotics. Probiotic can be taken on a general time also. It is always recommended that you take the probiotic morning and night when you're taking it. If it's with the antibiotic, maybe yes, from the day you're starting the antibiotic, you continue the probiotic. And once you've stopped your antibiotic, take it for 1 or 2, 3 days and then stop the probiotic.
Great message to all the viewers, and I'm very sure that the points that we discussed here today will be very helpful. It was a knowledge gaining session for me as well, so I'm very sure that the audience must have also learned, a new concept here, that probiotics benefit in antibiotic treatment. So I thank you, sir, for sharing your insights and your clinical experience on benefit of probiotics in antibiotic therapy. Thank you so much.
Thank you. Thank you so much. Thank you. Thank you, Dr. Shweta.